Thank you, Madam Chairman. Mr. Secretary, New Hampshire is one of those states that has really been devastated by the opioid epidemic. For too many families, this isn't just an emergency, it's a daily heartbreak because they've lost people they love. During the first Trump administration, I worked closely with Health and Human Services to secure critical funding for New Hampshire through the state opioid response grant program. That funding has saved lives. We've made sure in New Hampshire that nearly every paramedic, firefighter, law enforcement officer has access to life-saving naloxone or Narcan. And we've also supported prevention and recovery programs that are turning the tide against addiction. We are finally beginning to see our overdose death rate go down. But I am deeply concerned that this progress is now at risk because Health and Human Services has already clawed back nearly $5 million in mental health and substance use treatment funds that are allocated to New Hampshire. And now your budget proposes eliminating SAMHSA entirely and consolidating critical substance use and mental health block grants under a vague framework that's not at all clear to me. So, Secretary Kennedy, will you commit to preserving the state opioid response grant program and to working with this committee, with my office, to ensure that states like New Hampshire, which are suffering from high rates of addiction, receive the funding and support that they need?
Senator, this is an issue that's very close to my heart. I lost a brother to this disease. I lost other family members. I lost a niece who was essentially a daughter to me. During the pandemic, I had my own 14-year struggle with heroin addiction. And it's always been a priority, and it will continue to be a priority for me. And I think all of the interventions that you talked about are interventions that we're going to support on Narcan, naloxone, naltrexone, Suboxone, methadone. My own bias is toward community care programs that I think are less expensive and the most effective, but there are many people who cannot take advantage of them, and we will continue to support the states
Mr.
and
Secretary,
state programs.
I don't want to interrupt, but I have read some reports of the struggles that your family has had, so I appreciate and understand why you would be sympathetic to this challenge, and that's why it's so hard for me to understand why you would be considering programs that have been working like the state opioid response grants, because what they do in New Hampshire, maybe they don't do this in other states, but in New Hampshire, those dollars go directly to the local treatment programs. We have a whole system that's set up based on those that allows people to get treatment and recovery in their communities, that's designed to ensure that they can get that. And so that's why I'm so troubled by the idea that you would eliminate the entity that makes those grants available.
Senator, we support 500 community care facilities around the country. We're going to continue to do that, and we will continue to support the most effective ways of ending the opioid. And we have not done a good job at that in the past. We can do a lot better. We need outcome-based care.
So, but you won't commit to preserving the state opioid response grants?
I have to look at that particular grant, but if it's working, we want to support it.
To move on to another topic, I co-chair the Senate Diabetes Caucus alongside Chair Collins, who I think has been here already today. We've spent years, literally, working to try and increase funding for diabetes research, to ensure access to new treatments. It's one of our most expensive chronic illnesses in this country. And yet earlier this year, your administration announced a pause on the Diabetes Prevention Program Outcome Study, which is one of those initiatives that's designed to help us figure out what the long-term impacts of diabetes are and how we can better intervene and promote alternatives. So this study, I think, is essential to understand how we better address diabetes, and you've consistently emphasized the need to improve chronic disease treatment in our country. So again, will you commit to funding this study so that we can continue to learn how to better prevent and treat diabetes?
I have no idea why that study was paused. If it was paused, I would have to talk to Jay Bhattacharya about that. There were thousands of studies that were put on pause and then refunded. I expect, knowing Jay's commitment to it, my commitment to that study will continue to be funded.
So you will commit to looking at that? And
Oh, I will commit to looking at it, and I'm happy to talk to you and to your staff at any time to try to help you with this issue.
Thank you. Thank you, Madam Chair.
Thank you. Senator Mullen.
Thank you so much, and thank you, Secretary, for